Mabadiliko ya tabia nchi au hali ya anga yamekuwa donda sugu kote duniani. Inakisiwa kuwa mabadiliko haya yanaweza kukithiri pakubwa afya ya binadamu. Huku Kenya ikiungana na mataifa mengine kukabiliana na janga hili, tulikita kambi katika kaunti ya Siaya kutathmini hasa madhara mabadiliko haya yanaleta kwenye afya ya binadamu. Daktari Martin Konyango, ambaye ndiye waziri wa afya kaunti ya Siaya, anatueleza zaidi moja kwa moja madhara haya.
When it comes to the impacts of climate change, you can categorize them into various areas, and these ones involve the severe weather change, the air pollution, change in vector ecology, increasing allergens, and water quality impacts, water and food supply impacts, environmental degradation, extreme heat, amongst many others. Coming to the severe weather change, increase in injuries, fatalities, and mental health impacts will occur when the weather is very severe. Emergency preparedness and management strategies like community engagement are necessary. Partnerships and information sharing. That is under severe weather change. When it comes to air pollution, this is a place where the impacts involve various diseases, especially respiratory diseases like the asthma, the bronchospasms. Cardiovascular diseases will also be affected by air pollution. We provide health promotion services through health and safety advisories and treatments of these cases. The third area where you have impact is the change in vector ecology. This one is very important. Usually with the climatic change, there will be increase in prevalence and in cases, or especially of malaria, dengue fever, encephalitis, various other viruses, Rift Valley fever, and chikungunya fever. All these diseases during climate change, the vectors involved in transmission of these diseases are affected. The best example in our case is when it comes to malaria. We have a situation whereby certain strains have been discovered due to a change in the climatic weather patterns. The mosquito strain of Stephensis, apparently research has shown that it has been discovered due to impact in climatic change. This is in addition to the current species which are in existence. The ones we are more conversant with, Anopheles, Culex, Aedes aegypti, Vivax, all these ones have been in existence, but Stephensis has been identified due to climatic change. This one is also transmitting malaria. It's there in Kenya and in other advanced areas in the world, and it is changing the pattern of malaria transmission. This is because this particular species, the mosquito bites all the time, as opposed to the other ones that I've said, which have their specific timings when they transmit the disease. The other area which impacts due to climatic change are areas where you have increasing allergens. Again, this one affects respiratory system. Increasing allergens affects plants very much, whereby the pollination and the flowering patterns change, and during those times, those members in the community who are allergic end up having increased respiratory allergic conditions, and this affects their health more. The fifth area is due to the climatic change, you have water quality impacts, too much flooding. During these flooding periods, we all know that certain diseases increase in outbreak, diseases like cholera. There are also some other conditions, mainly GI tract conditions, and also fungal infections. And during this time, disease prevention and management becomes a big problem, and we get epidemics and major outbreaks due to the impact on climatic change. We have also situations where water and food supply are impacted, and the disturbance in the rain patterns and the seasons affects the agricultural produce, and this affects availability of food. The food security is tampered with, and in the medical world, you end up with increased malnutrition and even diarrheal diseases, especially affecting the infants and the children.
Katika harakati za kuhakikisha kila idara husika imehusishwa, tulifanya juu chini kusikia kutoka kwa idara ya mazingira na hali ya anga na ile ya kilimo. Jacqueline Oduol ni waziri wa mazingira, tabia nchi na rasilimali za kiasili kaunti ya Siaya.
From the Department of Water, Environment, Climate Change and Natural Resources here in Siaya County, I'd like to confirm that indeed the unprecedented and extreme changes, particularly with regards to weather, has had major mental risks. One, which is not so obvious, is the mental health challenges with the kinds of pressures. As we look at the way that the enhanced rainfall, for example, affected our county here in Siaya, we found that there was increasing insecurity, and that there were ways in which even the very law enforcement groups were not able to move with the speed that they would want to attend to a number of issues. We also found that there was increased dog bite because of the manner in which this weather extreme changes took place, and of course there is the clear area of malaria. I therefore would want to say that as we think of climate change, we need to see that we are talking with unprecedented, unpredictable patterns, and these range not only from the kinds of rainfall and water, but also how farmers and traders and almost every category does not get to get their work done in the way that they could. A number of markets here in Siaya really were inaccessible to the women, to the men, to all kinds of people who wanted to go about their business. And therefore, I would want to say that key health risks exist, and they are not just with regards to physical health. They pertain also to emotional health, to mental health, and to really just a sense of well-being and livelihood of the people.
Thank you.
Namna walivyosema wahenga, atafutaye hachoki, akichoka kushapata. Kabla ya kuchoka kwetu, tulitafuta maoni kutoka katika idara ya kilimo na pia kuhusisha wananchi waliona msukumo wa kuleta mabadiliko katika hali ya anga.
Weather conditions, so much so that we have increased cases of flooding and prolonged seasons of drought. The two extreme cases occasioned by climate change greatly and negatively so affect food and nutrition security, because we need a good environment, we need adequate rainfall, and we need just enough water to carry out food production. So extensive seasons of drought affects agricultural production, because you realize that last year alone because of drought, some counties in northeastern part of Kenya lost almost 8 million herd of cattle. And because of floods or the enhanced rainfall that we recently experienced, some of the counties in the Lake Basin region, including Homa Bay, Migori, Kisumu, Siaya, Busia, were greatly affected by flooding, and it means that crops were damaged. So it is evident that the impact of climate change generally affect agriculture and specifically affect matters of food security than even anywhere else, than even health and other departments.
So you find we harvest, but because we always rely on the sun for drying our maize and beans, you find that during the rain, when it is raining during harvest, we cannot, the maize cannot dry properly. So we end up, they end up rotting or something, going bad. They form that aflatoxin. They contain that aflatoxin. But where do we take this waste or this bad maize? We feed them to our cows, we feed them to our chicken, which in turn we also eat or consume. So we end up getting this aflatoxin from the cows or the chicken, which is actually aflatoxin is cancerous. So in the long run, it affects us in a health way.
In the climate change program, we have a number of activities that we are undertaking, which includes climate change education, where we want the public to understand the risks of climate change. And more so in food production, we've had very low food production due to climatic changes, which are beyond human beings' control. We realize that we cannot get enough production in the crops that we are doing, and that is why, as the Committee of Climate Change, we are championing to do crops that are climate change friendly.
Hii ikiwa tu mwanzo wa safari zetu za kutathmini madhara ya tabia nchi katika maisha ya binadamu. Mengi yapo njiani na bado twazisubiri. Alex Odhiambo, Ugenya TV.